There is no international process for investigating the origins of the pandemic. But there are two major hypotheses. The other one is the accidental lab incident.
President Trump weaponized this subject and made the very questioning of the origins of the virus radioactive for a lot of people.
There was so little space, even for Democrats, even for progressives, to ask the questions.
A preview there of a Nightline special airing this week with exclusive new reporting on the origins of COVID-19. So let's talk about that and more with ABC News contributor Tom Bossert, who served as Homeland Security Advisor to President Trump, and Dr. Ashish Jha, Dean of the Brown University School of Public Health. Welcome to you both this morning. And Tom, I want to start with you. Why was the laboratory theory seemingly dismissed so quickly by scientists?
You know, a 300-page report conducted by scientists and researchers, and they early abandoned the notion that it could have been intentionally or accidentally released from this lab. No real reason for it other than, from what we can tell, they thought it was least likely as an option.
And what does it take to know for sure where it did come from?
There's kind of these three competing theories. Was it naturally occurring from animals and then spreading naturally? Was it naturally occurring zoonotic, from animals, then captured, harvested, studied, and accidentally released? Or were they tinkering with it for scientific purposes, but in a controversial way, and then let this gain of function research, and then let it out? I think the biggest and fastest way to resolve this would be to find the animal reservoir, find that missing link. Remember, we found a civet cat, the animal that was the most, closely related link before it jumped to humans for the last COVID, SARS outbreak. We don't have that animal reservoir right now. It would put to rest all of these concerns, but it also fuels the belief that it might have been a gain-of-function accident. So we don't know yet.
And Dr. Jha, how important is it to the medical community to know the origins of this pandemic?
Yeah, so Martha, I think it's pretty important. I mean, this has obviously been a horrendous pandemic, and we need to understand where it came from for a variety of reasons, not the least of which is it will be very helpful for preventing the next one. If it is indeed from a lab, that means we have got to really think about lab safety at a very, very different level. If it's zoonotic, then we have to put in a very different set of policies to try to prevent something like this. So I think it remains critically important that we figure this out.
In terms of lessons learned, where we are right now, what have we really learned?
Well, we've learned a lot about this pandemic and how to prevent it. We have learned that vaccines can be developed quickly if the scientific community puts its mind to it. And we've learned that there's still deep inequities in our globe in terms of how the pandemic plays out. Right now, America is in great shape. That's terrific. And many, many parts of the world are struggling. And if we're going to get out of a global pandemic, we've got to have much more global coordination. I think one of the things we've learned is without global coordination, it's very hard to fight a global pandemic.
And Tom, to his point, I know President Biden said the U.S. will buy 500 million Pfizer vaccines for global distribution, but that is really a fraction of the 11 billion doses that are needed. And while cases in the U.S. are indeed falling, there have been more COVID-related deaths worldwide in 2021 so far than in all of 2020. So how bad is this going to get worldwide, and what does it mean for us here?
Well, Dr. Tedros, the head of the World Health Organization, called this a two-track pandemic, and I thought that caught my eye. What he's saying is for wealthy countries that can afford it, we're going to have a return to normal, and for those who are poor and can't, we're going to have a continued struggle, loss of life and death. And it's going to slow return to trade, return to travel, and ultimately the biggest concern beyond just the amazing loss of life that still could lay in front of us, and tragic loss of life, is the fact that we could have a variant that's resistant to the vaccine and start this all over again.
And we already have some variants. And Dr. Jha, the Delta variant, first discovered in India, now makes up to 90% of new coronavirus cases in Britain, 6% of the new cases in the U.S. How significant a threat does that pose to unvaccinated people and also vaccinated?
Yeah, so the Delta variant is by far the most contagious variant of this virus we have seen in the entire pandemic. The reason it makes up 90% of the UK is because it has just outcompeted every other version of the virus. It's a very, very contagious virus. The good news is the data suggests that if you've been fully vaccinated, you remain protected, that the vaccines hold up. but more than a third of American adults have not yet been vaccinated. Obviously, a lot of younger kids have not. It's a pretty substantial threat to them. So we have got to get more people vaccinated if we want to get the Delta variant dealt with.
And Tom, there are many, many people out there who have not been vaccinated. Do you believe those people, other than younger people, and that goes on, those people who just haven't gotten vaccinated yet as adults will?
I don't know if they will, but they should. In fact, this is a story of 2 vaccines and 2 pandemics right now. In this country, I think the doctor's right. We're going to see a 3rd wave. It won't be as bad or perhaps not have as high a mortality rate tied to it. But these aren't just evenly distributed numbers. There are geographic pockets in this country of people that are not vaccinated. I think 5 states, Tennessee and others, are below 50%, at or below 50%. And so in those areas, I would imagine, and in fact, I would predict here, that this Delta variant and some of the other variants, P1, the one we first saw in South America, will take root, and we will have another spike in those regions. So it's not over for you if you're not vaccinated. And for me, I see 42% vaccinated fully, and most places I go, 100% of the people not wearing masks. So there's some difference there, and we're going to have to get to the bottom of it. I don't know how to convince them.
And Dr. Jha, just finally, we just have a couple of seconds here. What about boosters? Some people have been vaccinated for about 5 months now. When will those start being distributed, and is there a plan for that?
Yeah, I have to tell you, Martha, I'm not thinking about boosters right now. These vaccines look so incredibly good and so durable that I don't think most Americans are going to need a booster this year. They might at some point next year. I know we've heard from the companies that people might need a booster within the year. We've got to pay attention to the data. If the data suggests that there are starting to be more breakthrough infections, then maybe. But I expect that if we're going to get boosters, it'll be in 2022 and maybe even beyond.
Okay, we'll end on that good note. Thanks very much to both of you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.